You're listening to the Out of the Box podcast with Timmy, Halisa and Sinosure.
Hello, welcome back. This is Out of the Box. I'm Halisa, and there's Duro, Timmy, and Sinosure, like usual, right? So today we have guests. We'd like to talk about what's going on in our country, but it's not as recent, as you might want to think this particular topic is, because I'm sure you saw the topic before you clicked on the podcast. So we want to talk about drugs. So I don't want to even say drug abuse, just, straight up, but we want to talk about this drug should I call it problem that we're beginning to have in Nigeria. And it seems like it's been a long time, but we have guests here to help us out. So what inspired this whole thing? Recently, we have the passing of Mohbad, who is a very talented Afrobeat artist, and it's raised a lot of questions. And yes, I would like to give a disclaimer before I go into even talking about it, because many people want to say we are trying to project here. We are not trying to do that. So when we speak on this podcast, we're not just speaking on one person, we're speaking on the society, right? So yes, there's been no indictment to say Mohbad, what, please don't help us draw any conclusions. But yes, so rest in peace, Mohbad, and justice for Mohbad. So he's not particularly the person we are speaking on, but his death has, made us ask a lot of questions as a people. And one of those questions is drug abuse a problem, or is drug, abuse on the rise in Nigeria? And I have two professionals here to join in this conversation and actually share a wealth of knowledge, so we know what's going on in the country, and we try to tap into that particular conversation. So we have Dr. Dab. Actually, Dab, he was our guest before, so you've listened to him. And we have Ladoyin, and we'll hear from them. So Dab and Ladoyin, please welcome. Thanks for joining us on this conversation today.
Thank you very much for having us.
So let's have Ladoyin first, since the people are familiar. But yeah, Ladoyin, thank you. And can you let the people meet you, please? Hello.
Hi. Okay, so I'm Ladoyin. I am a nurse. I am a registered nurse, registered midwife, registered public health nurse. I have some certifications in drug abuse, and I've done a few papers on them. And yes, I think that's probably one of the reasons why I was invited over here to come speak about it. So yeah, I think that's the introduction. Is there something else you want me to say?
No, I mean, that's okay for now. And Dab, please, since we are not talking just politics today, so yes, if you want to jump in and just speak, just let us hear your voice before we start asking questions.
I'm used to politics. Why didn't you bring me in for politics? But thank you so much for inviting me once again. It's Dr. Ademola Bayonle. I always say I do everything I'm asked to do, and that's just me.
That's great.
Definitely, I have a medical degree, public health degree, and I'm in that space.
Thank you. So, where should we start this conversation from? We have professionals here, so I think we shouldn't even waste so much time. But recently, I have a friend that told me, I shared this story briefly with Ladoyin. She was like, yeah, I moved recently to Lagos, and I think there is something happening that I don't understand. There's a lot happening in the parties, and I asked her, what do you mean? What's going on? She said, anywhere you go, they are giving you pills. Anywhere you go, they're giving you pills. And I just thought, okay, I don't get what you're saying. And then she had to tell me more about it. Like they give you pills like it's water, is wine. When you don't even have to ask questions, because everybody it's kind of assumed to be involved in one type of drug or another. So I just wanted to share a little bit of knowledge about what you know about. Is drug, use on the rise in general? Do you think so, that drug use is on the rise, or we are just kind of having a moral panic for no reason? Let's have Ladoyin first. Ladoyin.
So yes, I think we do have a drug problem in Nigeria. I think drug abuse and drug use Is on the rise in the country, yes. And I will back it up with facts. According to an article that was written by United Nations Office of Drug and Crime, I think that should be 2021, they did say that Nigeria has 14.4% higher rise in drug use prevalence, which is significantly higher than the global average. I think the global average would be like 5.5. So, yes, if we are panicking now, and that was a statistics that was put out in 2021. So, this is 2023. If we're panicking now, yes, I think it's okay for us to panic because we definitely do have a drug problem.
So what are you comparing it to? What year are you comparing it to? I don't think I got it. Did you say 2021 and 2020 and now, or what year?
Yeah, I'm saying that that article was put out in 2021. And from the recent articles that they've written, they did talk about the fact that it's much more higher than that now. Do you understand? And the global average that they have is 5.5. So if at
Oh, that's
2020
more than times two.
yeah, exactly. So if at 2021 that the global average was 5.5, Nigeria had 14.4, we can almost imagine what the numbers will be at 20, like right now in 2023.
Wow. Yes. So, Dab, can you also jump in there?
I mean, just a snapshot of what she has said. We don't even need to check the trend, but I think I probably saw that article also. It seems that there's something on the rise there. There's a lot of data outside saying different stuffs, but if you're even comparing like a snapshot time of, oh, in this time period, compare, you guys are at 14.5, about 14 million people using one thing or the other out of about 200 million people. That's a lot of concern. We should be worried about that. So it's also the era of social media. Apart from the data, even visibly, we all see it every quarter. I was on the ground. I was in the communities a couple of months back, and everywhere you turn to, the youths are into this now, are into that. You can also see them do it. So the conversation is rising, the numbers are speaking, and I think it's worthy to talk about.
Okay. Yes. So when we talk about drugs, sometimes some people just zero their minds into like one or two things. But can you give us like an expansive view or like maybe a list sort of what drugs are? Or, even if you can go into description, since this is just a podcast and people can listen, so they know that when someone is giving them something, it's not really paracetamol. So, are there any types of drugs like that are being used that you want to like specify, if you want to share that?
Okay, so I think that we should broadly classify these things into prescription medications, and both sides can be abused. Unfortunately, I think we're seeing more of street drugs now. People abuse prescription medications through opioids, tramadol. But in Nigeria, I think we're dealing more with substance like marijuana, cannabis. I mean, I think there's also so many names now that it's even hard to catch up with. Colorado, Belebe. So those, since I'm not, like I said, I'm not like an expert in it, but I hear and I see, and it's just a myriad of of substances now on our street. So like the cannabis, the marijuana, it's causing more havoc, and I think it's probably like out of like I think the 14.5%, I think 10 point something percent is due to cannabis. I think that's kind of like the drop down of what people are concerned about.
Yes, Lado, you will jump in, and I want to put a question in there before we even go to Lado. And you talked about prescription drugs and non-prescription, but cannabis seems like it can be it can be both. No?
Yeah, it can be both, but you see,
but in Nigeria, no.
They are synthesized differently. They are produced and processed differently. So the prescription one is clearly you can walk into a dispensary. You don't even need to have you don't even need to have a prescription. But it's not illegal or anything. You can literally walk into a dispensary and pick up some of the stuff. The street side of it, I
Yeah, but
think.
in Nigeria though, I think it's illegal, right?
I don't even think we have that. Yes, it's illegal, so we don't even have
Yeah,
it.
it's definitely illegal. So yes, in Nigeria they say it's illegal, but and yet, well, let's not talk about that too much for now. Ladoin,
Yeah.
Ladoin, can you jump in there?
Okay. I might not know the street names that they are called. Actually, I'm not sure I do. But yes, I do know that there are there's codeine. I think that one has been taken off the shelf lately. I'm not sure. There's tramadol as well. Um, I'm not sure. I think they abuse diazepam as well. And of course we have the big guns like cannabis, cocaine, amphetamine, heroin, all of that. So yes, I think those are the ones that I know of, really. So
I found
Yeah.
I'm
I
sure
heard they also sniff all this kind of stuff, and there's a wide spectrum. Well, I can say categorically that it's also not a Nigerian thing. It's not only Nigeria. Yeah, everywhere.
It's like everybody is exploring, but I feel like for Nigeria, for it to be, and thanks Ladoni for bringing those, percentages out, because I feel like it actually helps my question, right? Because yes, the world has that problem, but they said it's growing or it's at 5% and Nigeria is at 14, right? So I'm thinking, are there other factors? Do you think there are other factors that just allows for, drug use in that way, substance abuse to thrive in Nigeria? Would you, even if it's like hypothetically, what do you think makes it such in Nigeria?
So, like I always say, the things you see, we have to have laws for a whole lot of things, and aside having laws, we need law enforcement. One thing we have also not mentioned is alcohol. I think we forgot to mention that. If you, yeah, yeah. So
number one.
yeah, no, exactly. You can be 15, you can be 16, and access is there, like it's free. I don't know. It's been ages. I went to anything called like nightclubs or something in Nigeria, but I don't know if people are carded like they are here. Do bouncers actually check how old are you before you can get into a nightclub? Do you have to show your ID?
I don't know that they're even buying it from. Are they buying? I don't know that anybody. Not really.
So what I'm saying is that I think that we have a very unregulated space in terms of policy and enforcement. So it is free for all. There's access. So I can go into a pharmaceutical or a pharmacy or chemist, like we call them colloquially, and say I want to buy tramadol. And if I don't even need to know anybody, I just need to be able to pay. That's it, right? There's really is not a regulated space. So, and when you don't have such enforcement, when you don't have such regulation in place, you can't enforce what is not regulated. I think availability is just there. So, accessing, I think one of the issues, which is just one of them, is that access is just like
So easy. Yeah, it's just there.
then with the new craving of or new arise of entertainment, social media, all our celebrities use substance. Most of them, don't let me say all, most of them use substance. And all in our, yeah, I know you, yeah, but it's the truth. All in our, and
But
there's
the
something
fact that someone uses does not mean they abuse, right?
you
But
guys
these
saying
are not even things.
sorry, go ahead.
But these are not even things that it should be using, right?
Well,
Okay.
There-
they say
There's some
now
of
from
them.
clap, then they enter dance. You have to first use before you abuse. Before you abuse. You can't just one day start using or start abusing. I mean, it's probably possible, but you have to first use. And there's modeling. You can't discountenance the place of modeling. People look at people and dress the way they dress. People look at people and walk the way they walk. I've had people who like to smoke because they like how the shape of that smoke kind of like comes out. You get very mundane things that people pick up. So if our favorites, our celebrities, have a red cup, and we know it's not water that is inside, so it looks
Yeah.
fashionable.
No, but red cup being fashionable is just one that I cannot understand. When did that happen? I,
No,
I,
but
I don't understand when that happened. Yeah.
right? Am I lying? Everybody's always carrying one cup
Yeah.
that's covered. Everybody's trying to be funky and cute and
And then
everything.
tomorrow they will say save the environment.
Classic, right? So it's unregulated. What are we calling for? So that's my own. I don't know if Ladoin has something extra, but that's what I
Yeah, yeah.
feel.
Let's hear it, Ladwin. Ladwin, what do you think?
I
Why?
just I'm
Mm-hmm.
gonna say that first and foremost, we should not forget that this has become like quite a global disorder. So we just talk about drug abuse, drug abuse. You know, let me move it quickly down to psychiatry. You know, they'll call it substance use disorder, this drug addiction. And from their definition, they will say it's a disease that affects a person's brain and behavior and leads to an inability to control the use of legal or illegal drugs. And a lot of times, most of this addictions start experimentally. My friend is doing it. We went to a party. They gave us brownie, that kind of stuff, and it made me feel some type of way. So most people that have become addicted now started as recreational drug users. You know, they do it once a while, once in 6 months, and after a while, something leads to another, or they have more access to it, and they start to do it. So I would say, oh, the fact that someone is taking it does not mean that they have to abuse it. You need to understand that sometimes the way the brain works, yeah, and the pressure of young people in the society by their own peers has led them to a point where, I don't know if a lot of you remember when shisha started raining. Can anybody remember how the rave about shisha? And people will tell you it's so healthy, right? They will tell you it's just
And the
flavored.
flavors, bananas. I think
Yes,
even when I think my friend in high school then was even saying, "Oh, I hope she wasn't doing it," because now that I think about it, it was something they made so fancy. Well, go ahead, go
exactly.
ahead.
Exactly. Just like Dr. Dab was talking about, is something that when they want to get young people into trouble, they package whatever it is they're showing off in very soothing, very inviting wrappers or packages, and that's the reason why celebrities will have their musical videos and have red cups on. They're drinking, they're taking like some sort of cigarette or weed or whatever it is, like a boss don kind of person seated in a fancy chair, calling the shots with what's it called now, with a suitcase filled with money. Those, I feel like those are the kind of things that a lot of women shaking and doing all them whatever it is. Those are the kind of things that attracts your people, and they feel like, oh, if I don't worry, let me just start small. Maybe by the time I owe to have enough money, I'll be able to control things like this. Do you get? Nobody comes out to talk to them about the harm or the aftermath, the effect of what these things it will be doing to their body or their organs, right? So that's the problem. It's a really huge problem, and the entertainment industry, because a lot of young people look up to artists now. You will hear them say, "I want to be like so person. I want to make it like so person." So invariably, these people are like role models and mentors to a lot of them. So I don't know. That's what we need to sort out as part of the things we need to talk to the authorities about. There has to be regulation because younger people are very impressionable, and there is no censor to what you can watch on TV or what you can listen to, right? So yeah,
Yeah.
that's
I was arguing something very differently, with someone recently, with people recently, because I just felt like I was expecting maybe some sort of poverty would be one of the reasons, maybe stress, lack of job, is like idleness, things like that would be part of the reasons. But yeah, I was arguing with someone recently, and they said the entertainment industry, and I just thought, like, the only what do you call it, what's the word I'll use now, the only thing that shows, my English is like dead, but the only indicator of wealth now for young people is like this entertainment. So it seems like there's no alternative. We don't see a lot of doctors that are living, I'm so sorry, doctor, but we don't see a lot of doctors on TV that are projected to make a lot of money. We don't see a lot of business people. We don't see alternatives in our society. And then it's sort of hard for you to say, okay, authorities, take this out. Like, maybe start censoring what we see on like MTV. I'm not sure a lot of people watch TV these days, but YouTube, but it's like, if you start censoring this without even giving people alternatives, I found it to be like, wow, I don't know how we are going to solve this problem, So yeah, there's just a lot of conversation around, how the authorities would go about that. For me, I just feel like there should be alternative type of success that is projected to young people, and then people can say, I don't need to do entertainment, I don't need to this person does not need to be my role model, and they can live like different lives. They need to be able to see those things. But that being said, so I just wanted to ask this question before we actually go into addiction. Maybe this is going to help. So have you ever witnessed someone that has been wrecked because of this before? Do you have like any story, or you've heard, or you've read, or just something that would make people like, see these things? Because what we see on the social media is people using these things and actually doing very well. They look debatably, but they look sort of healthy. They look like there's no problem. So do you have like stories, or have you heard anything that how someone has been wrecked because of this substance abuse before? Can we hear from you, Dab, before we move to that doing?
This is close home, actually. Absolutely. It's a very close family member due to overdose.
I'm so sorry.
And yeah, so it's been a long battle, actually. More than 10 years. I mean, we all went through to different extent that battle. So it's not, so for me it's not like far away. Conspicuously, you can see attitudinal changes, even like not even physical changes, twitches, sometimes itches, etc. It's pretty out there. And I won't be surprised if a lot of people you talk to have had encounters in different ways. So it's not only like the access to celebrities, the etc. There's a poverty component to it. There's the framing in terms of what people are seeing, also component to it. There's so many parts to it that predisposed just genetically to addiction. So when the environmental factor hacked on it, they have little substance. Their pleasure center is just hypersensitive, and they are hung on it. It's just everywhere. It's multifactorial, many hydra headed. It's a slippery slope, and hopefully we can get around it. So yeah.
Ladwin, can we hear from you? It could be it's something else. It could be like it's something you actually just saw or you witnessed as a health person.
Yeah. I'm so sorry, Dr. Dab, about what happened. For me, I will just talk from the aspect of the patients that I've met, families that I've related with, and not necessarily a personal story. Let me just give this one quick story. I remember there was a young lady. This is a very, I don't know, like dealing with that patient. Really, I got very personally involved with the patient, and having her pass was a problem for me. Anyway, so she was quite young. I think she was probably 20, 21, and she started doing, I think the first time she did tell us that she had an encounter with drug was at a party that a friend invited her to, and for some reason, I don't know, those people that organized the party put like some sort of I don't know what it is, weed, whatever, in some of the brownies, right? And they didn't tell anybody. They just passed it around. She ate it and all of that. And she ate a lot of it, and she got quite high and all that. And that was the beginning of her problem. Right after a couple of months or almost a year, as she was with someone, I think a boyfriend, who also was into a little bit of drinking and, drugs. And after a while, she tried to fight after that first episode but being with someone that is actually into it kind of just made it like, okay, we can do it together as a couple. And both of them started doing drugs together and all of that. She got pregnant. Throughout her pregnancy, she was on drugs from time to time. They had to get her into the hospital and out of it and all of that.
She was pregnant?
Yes, yes. That was
Wow.
one problem. But luckily for her, by the time she had the baby was mostly okay. And, for the baby's sake, she did tell us at that time that, oh, she's going to continue. She's going to completely stop. She's going to try to focus on taking care of the child. And the guy that impregnated her, like her boyfriend at the time, left her alone and, moved on with his life. So she was a single mom trying to take care of her, I don't know, of her own kid by herself. But at some point, I think she became very frustrated. She didn't have a lot of money. Life issues, just got her really, I don't know, it got to her. And, for her to just get out of that fix or, just feel a little bit better away from her problems, she went back into drugs. At the time, she had like a 3-month-old baby, and then she will take drugs, she will go out with friends, reconnect her with some of her old friends, leave the child in the house, lock the door, and go party, right? She will come back, take care of her baby. She's been doing that for a few weeks until one day she partied overnight, left the child alone in the house by herself. One day turned into 2 days and all of that. One of those days, she became really, really high. After not seeing the child for a couple of days, child was crying in the house. Neighbors tried all they can to get to the child or whatever. There was a fire. Long and short of it, the child died. She was brought in the hospital. We tried to get her, like, get her the normal regimen to get her get the drug out of the system and all of that. When she was finally sane and figured out that our child has passed because of, what happened and negligence on her path, she committed suicide. I can never forget that
Wow.
story because as much as we see people that a lot of people will not come out to tell the stories of people that have had drug problems. And I know that the community and society, the entertainment industry glamorizes it. There are people that have really, had issues that has led to death. And I remember when our mother came to pick, to get a body, our mom was like, she was so brilliant in school. She was one of the few, she was from a poor home. She was one of the few people that they thought that at least this one is going to get out and she's going to make it. So imagine that just because of one party that she went to.
Just brownie, right? And you might
Yeah.
not even know, you might not have known what was inside.
Yeah. So it's and that's one story. I can go on and on of many stories I know. There's some that got out of it and they got the help that they needed, but there are a lot of people that could not get such help, especially those that maybe they come from very poor homes or their family members are not very enlightened about stuff like this. People that are now in psychiatric homes from drugs. It's just a lot, right? It's a lot. And we can't continue to lose our young people like that, right?
Yeah. Do you know if we even have facilities in Nigeria to help? So the addiction problem, if there is an addiction problem, because I don't know that I've heard of facilities. Do you have an idea? Or do you have an idea of helplines or something? And also, I want us to also maybe touch on the symptom. Maybe someone has a friend now, and the person is moving like not the same. How would they note those things, and how, or if they have a family, for example, how would they take note of those things, and how would they even try to help those people? So, yeah, and if we do have any kind of facilities or help in Nigeria.
I'm not I know of private facilities, but they are very, very expensive, right? That I know. But I don't know if there's any government owned facility. Maybe Dr. Dab can help me, but I don't think so. I don't think so.
We have one rehabilitation center in Abuja for NDLEA, and I think I have it very, really small, and that's what we have for the whole country. So for symptoms, you see, is that you notice a change from baseline, from that person. I mean, if you're close to that person, you will naturally see that the person is to himself. They even steal because they have to fund some of this lifestyle. And just to also put it out there, it's not only poor people that do drugs or substance. A lot of rich guys are also really into it. Everything is not religious. Everything is not all spiritual. Some things are just
preach. Yes.
No, yeah, some things are just more.
Exactly. That's the kind of preaching is necessary.
Some things are just
everything
more,
is not spiritual, because many people might just easily like not even get their family or friends tested or anything like that, and they would have just like easily. So that's a very important point.
Let me just sit him down and talk to him. That's not how some of these things work. I think I'm leaving the symptoms part of it. We're going into a more different type of conversation because it's always
allowed. Yeah.
For instance, somebody with depression or mental health problems, and you're like, and it can coexist actually. I forgot in the diagnosis for that. You can have somebody with mental health disorder and also have a substance use disorder. There might be a lot of private or hospitals might just be the best or the first. Maybe detox is usually the maintenance bit of things that are tough. The detoxification and getting that person to the baseline. I'm sure most hospitals can.
Yeah.
Maintenance phase. Because this is always a long battle. Believe me, it's a long battle, and the rehabs are probably best suited for those kind of things. But when we notice it, I think it's great to like approach healthcare providers. So I know somebody who is even in Nigeria, but uses the mental health counselors in the US and all. So and I think there's a lot of online facilities these days either way.
Yeah, because I was thinking when you said that only one that clinic, there's only one clinic. I'm like, so there's no hope, but if it can be done, like maybe the initial part can be done in like just general hospitals, and then you can also like seek help.
And like my country, like every other thing, we never do anything until there's an epidemic or something big happens. Mohbad dies. That is not the first artist, by the way, that's going to have. I'm sure there are a lot of artists in the Nollywood that I probably don't know their names or probably don't want to mention their names, that they've been said to have a lot big time mental issues. It's really, really enough. I think our entertainment industry now for everybody. For some reason, I was saying, you see, the type of song, hip hop, I don't think you can sing those kind of songs with a clean high either way. So, it's usually, I think it emanates from a community. And when I mean a community, like a tribe, like some set of people who just have that verbiage, who have that lingo. I'm sure there are a lot of artists that are probably shy. But when they use and they can face the crowd, it's not easy facing thousands of people. I think I've been all around talking just.
No. It's a broad topic at the end of the day. Yes, and sometimes when you even talk about this and you also bring in mental health is like almost another thing. The one we are very sure of is, like you even brought in Mobad, is that yes, he complained about depression, but one thing people were very sure about, they were like, they never even saw him smoke, right? So we're just talking about the industry he was in and the record label. It might have been very difficult for him not to have even had one smoke. So we don't know. So we're just talking about it like in general, because that industry and this music industry of a thing is beginning to scare me, because I really like Afrobeat and everything. But
You can always go into a rehab, and it's the non-judgmental zone. Do you understand? People can, oh, I'm checking into the rehab. I'm going to like have some
more
2 months or
focus on
three
the
months.
non-judgmental zone. Nigerians left this chat group right now. Did you see them running?
Yeah.
Emphasis on the non-judgmental space, but it definitely has to. Of course, I'm sure if they have to be professional, they just have to like wear their big boy pants and be professionals. So,
Yeah, but
yeah.
how many people, if you say I needed to say psychiatric, everybody freaked out. I'm like, oh my god, people think you're going crazy. So we're
Mm.
so sensitive. I'm gonna go. Have you told your pastor? Have you prayed about it? And all those things. So we're so sensitive, and sometimes a lot of people don't want to share. They just like stay in that zone, and of course, bad things happen. Anytime you smile too much, they're like, is it back? Yeah, even social media, people who have struggled along the spectrums come out and talk about their journey, how they've been able to heal, etc. It's probably gonna help a little bit. Yeah.
Yeah, maybe. Well, uh, okay, Ladwin, please, you're going to come in. So maybe, do you think that was what any NDLEA were trying to do when they decided to make Naira Mali?
I mean,
sit on that a little bit. Ladwin, no, don't take that one. Ladwin, please go back on the how you help. How you think Nigerians can help first, so that you think about that topic, think about the mood of the nation before you take that topic. So yeah, Ladwin.
so I was just doing a little bit of digging, and I realized that NDLEA has they inaugurated a call center where people can call in and talk to them about drug problems. I don't know if it's in collaboration with the rehab center that Dr. Dab talked about, but I can see here that the helplines are manned by professional and experts in counseling, psychotherapy, psychology, and psychiatry, among others. And of course, it is in Abuja, but with an helpline, I mean, I feel like that way, if someone has an issue and they call in, since it's toll free, they can direct them to other facilities, albeit private, or even if it's just regular hospitals, or maybe they have like professionals that it can link them up to in various other states. So that is also good. And they did say that the helplines guarantees anonymity, confidentiality, and safety. And for people that probably have been out or they're trying to stay on the path of being clean, on days where you feel like you want, sometimes they relapse and they just have that urge, they can call these helplines, and someone can talk them through that situation, right? And it's 24/7, so they're always available, and that is great. But I don't think a lot of people even know that this kind of thing
I am just
exists.
hearing about it for the first time, honestly. So people can literally
Yeah,
just Google it and get the
yeah,
phone number, right?
is there. You can see it, and it might be helpful to somebody else,
Yeah.
and I think that's a good thing. But stuff like that, we need more of it in the country. We can do better for a nation of how many million people. What's it called, one rehab center by the government, or one helpline facility is not enough. Do you understand? We need to do better. We can do so much more. And also the society itself, we need to be very accommodating and accepting of people's weakness, of people's problem. Just like we have issues with people coming out to talk about having mental breakdowns, psychiatric problems, we also have issues with people coming out to talk about drug problems. If they are not shaming you for being weak, they are talking about why did you. I really hate that problem. That question. Sorry, pardon me. I hate that question when people find themselves in mess or they are trying to seek help. You're going back to the beginning and asking, why did you do it? How did you find yourself in this situation in the first place? Like, look, the deed has been done. The person has realized that they're wrong. They are here now. They want help. Just help them. Don't make them feel like they're horrible,
And even
horrible
getting,
people.
I hear getting to that point where you even want help is not even an easy journey. So if someone has, yeah,
Exactly. Exactly. For you to get to the point where you're saying, okay, can somebody help me? I am ready to, be taken care of. They've gone through a lot already. So taking them back to the point where, why did you find yourself in this situation in the first place? It's just mean, very unkind. And we can see that a lot of us, because we feel like some things can never happen to us, which is very laughable, do that because we just feel we're superior to other people that have weaknesses. And that's one thing we need to talk about, we need to fix in our community. Maybe that way people that are having this issue can come out and talk problems and get the desired help they need instead of just passing out or falling down and dying just like that, and then families are just thrown into mourning for issues that could be avoided. Yeah, so that's where I stand on that situation.
yeah, I really think that's very, very important. Really, very important point. But yeah, I mean, if you have like brothers or if you have people like younger adults, you'll just be so worried. You'll be so worried. What are these people? What kind of friends do they have? What are they trying? What are they doing? You can't stop them from going to hang out. You can't just bundle them and keep them at home. But then they can just go somewhere, eat something they are not even sure of. They might just think it's like cake and that's it. That's it. Wow. It's, well, I mean, I guess prayer is necessary to a certain point, but those hospitals, government, please, try to do something about it. It's very important that we actually know. This thing you even brought up, this data you even brought up, based on the fact that we don't have data, in quote, every time we don't have data, it might even be less. It could be less. There are chances that it's even less than what
I
we
don't think it's
actually
less.
have.
I think it's more. Yeah, I think
Sorry,
it's
yeah,
more.
chance that is more. Yeah, sorry.
Yeah,
Yeah, that's what I was trying to say.
I think we
Yes.
have more because there's really no place you turn
Yeah,
to.
I mean the data is less than what we actually have. So yes, there's like more cases.
I
Yeah,
think there are
yeah, right, right.
more, and people are just probably at different functionality or different spectrum along that addiction timeline or something. But it's just everywhere. Literally, there are places you will go to, and this is some political swing into it, and they're like, "Oh, you want the youth to work with you? Just give them Shinap, they will be fine." That's where we are.
Yeah, yeah. Let's good conversations, honestly. But like I said before, just wanted to bring in that distinct little swing because NDLA thought it was very good for them to bring a face of the a sort of like a face of substance to come and represent. So do you think that if it was someone that what were they trying to do?
No, so it's actually a great move, but you have to do it in a way when you know that person is an ex-addict, and see this person used to be this, and now it can relate more from a personal perspective. When people are saying that, oh, let's arrest, but like, there's nothing you're using I have not used before, and when you can relate with people on that level, that kind of like community, that kind of face, you listen to that person. So you bring somebody who is totally off that. You get what I'm saying? I don't know. I think NDLA came out and said it was not their ambassador because somebody I think wrote it at different places. I think people just carried it or something. Using the very like ex-addict people who have gone through that system before who can relate with you on a practical level is always a very strong voice in that type of community.
Yeah, and when you're watching movies, you see that they have someone they have this like AA AA community, and then you have someone that was in it before, yes, but then that person is now the person that helps you. What are those people even called? So if you have a structure that even helps provide you with somebody that could even understand you on that psychological level, you know that structure is actually meant to help, not to, play on your intelligence.
We shouldn't have a community of almost 10 million people who are hung on substance, and the only rehab center we have is in Abuja. The first place they usually come to is the hospital. Something usually happens before they seek help. I don't think half of them just say, oh, I'm on this crazy substance, I need help. And the first call is, oh, let's go to Abuja, or let's do this and everything. Sincerely. Yeah. So it's very pathetic. And I mean, there apart from government, we also have to look at institutions, churches, mosques,
schools, right? Schools in education, in curriculums,
yeah.
They need to probably start talking about it from early.
Exactly. Clubs. Yeah, I think there are actually some clubs for substance use. I think somebody reached out at some point, wanted me to give a talk or something. By the time you leave your house, you go to high school or primary school, you start making friends. Yes, you see 6-year-old people smoking. I was listening to J. Cole recently. Something just came on my timeline. I was very interested. I Googled him up and I listened to his story. He doesn't smoke because when he started smoking at 6 years, and I was like, oh my God, 6 years? But he said he stopped because his brother caught him. The mom felt dejected and everything, and that family structure kind of stopped him from smoking. Until date, he does not smoke. So people's family are the number one space they need to target. When they leave school, they go to institutions, church, mosque, whatever, and everything. All those places also, because prevention is always better when it comes to substance.
That was very good. You ended up very well for us. So, in fact, there's nothing more that I would say from this side, but don't do drugs. And thank you for joining us today. Honestly, I appreciate all of this. I'm sure a lot of people would have learned one or two things. In fact, many more than that. So, yes, thank you very much, and we'll see you in our next episode.